coming out tonight. I'm Barbara Lowe, and I'm on the board. I'm a nurse, yay. And I represent, of course, the representation from the City Council, Manhattan. This year, this is our fiscal year of 2023 and our public meeting for the year in the Borough of Manhattan. Before we start the formal program, I would like to call to your attention that we have language translation services, as usual, and those who would need it, if they speak Cantonese, Spanish, Mandarin, if you need these services, please call 212-788-3359. That's 212-788-3359. Thank you. As I said, I'm Barbara Lowe, I'm representative for the City Council for Manhattan. I'm on the board for a particularly long period of time. I don't ever want to get off this board. I love the work we've done. I've also been involved in various roles in the city, including an advocate for people like the likes of Judy Wessler in the back of the room, Dynamo. Joining me tonight are some real dynamic folks here, and we'll get to all the introduction in a second. I'll start with our board members. To my left is the chair of the board of directors, Mr. Jose Pagan. Right next to Jose is Robert Nolan, known very well in the Boogie Down Bronx. Represents that particular borough. And again, next to Robert is Ms. Jackie Rowe Adams. She happens to be part of the soul of Harlem for what she's done. Ms. Karen Sinclair. Ms. Sinclair is representing the Commissioner for the Department of Social Services, Molly Waslow Park. Dr. Mitchell Katz is the President and CEO, right next to me. I would like to recognize Peyton Schultze. I'm sorry for that poor pronunciation of the last name. Peyton is the community liaison for Senator Kristen Gonzalez in a listening capacity, so thank you. Also on the panel are Andrea Cohen, our Senior Vice President and General Counsel and moderator for tonight. At the end is Calicia Hercules, who does all the background work and facilitate the work that we do up front. Secretary for the corporation. Big title. On behalf of the board, I would like to extend our thanks and acknowledge leadership at our Manhattan facilities. George LeConte has just become a TV star. Thank you, George. Christina Contreras, Harlem Hospital. I don't see William Hicks, but he's like a spiritual brother of mine from Bellevue. Lloyd Long from the Carter Hospital. Both Carter Hospitals. And Stephen Catullo at the Carter as well. Cola? Okay. The typo, sorry for that. It's Cola. And Susan Sales from Gouverneur Sniff, Senior Nursing Student. I'd like to also recognize all the dedicated staff for providing exemplary services to our communities, our public system. We serve our people exceptionally well. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care for all. We have one more person, and the Chief of Nursing for our systems, Natalia. I did say I was a nurse. Now I would turn this mic over to our President and CEO, Dr. Mitch Katz, to continue his remarks.
Thanks, everyone, and we're so lucky to have Barbara on the board, given her long association with health and hospitals and the city and all the good work she did. I'm so lucky to be entering my 6th year at Health and Hospitals, and so proud of the many things that have happened in that time. We did, and I look out to the many nurses and other staff here. We did such amazing work during COVID. You all saved many, many lives. You comforted many, many people. You reached out to family members when we were unable to have people in the hospital come in because of fear of transmitting the virus. One of my favorite stories comes from this hospital, where a patient who was cared for every day by a nurse, this particular patient was on a ventilator in a coma. And then finally, after many, many days, he improved. He came off the ventilator. And as the nurse tells it, she started to say to him, "I want to introduce myself to you." And he said, "Oh, I know who you are. You're my nurse." And somehow knew, right, through that coma, knew who she was and who had taken care of him and had kept him alive all of those days. We're glad that although COVID is not completely gone, we've been able to return to a level of normality, especially in the skilled nursing facilities. We know that the residents are happy to be at a mask optional. It's allowed them to move more freely. We've been able, in many of our other areas, to have it be mask optional for people. We recognize that still in clinical areas, it's important that we all wear our masks because we don't know exactly what the risks are. Despite all of the amazing work we did on COVID, we didn't forget about all of the other things that we do. NYC Care reached 100,000 members. We launched Housing for Health and have already housed 400 patients. Several of our facilities, skilled nursing facilities, ranked in the top set of nursing facilities in the state. We opened a 3rd Gotham Center of Excellence. The New York State asked us to run the telephone line and prescribe Paxlovid for the entire state. When has that ever happened? The state said to Health and Hospitals, "You're the one we want to run our telehealth program for the entire state," and they pay us to do that. Be Heard is our program where we have social workers handling people in mental health crisis instead of police officers, because we know that social workers are expert at de-escalating difficult situations. We gave 15,000 Mpox vaccinations. We opened up our street health outreach and wellness programs, including prescribing buprenorphine. At all of our hospitals, we now offer plant-based lunches and dinners. We got from our city, state, and federal delegations over $100 million to help our facilities, which need quite a lot of new infrastructure. We increased how much we spend with minority and women-owned businesses by 3,000%, because we see this as one of the ways of achieving equity, to give more of our business to minority and women-owned businesses. We've provided care to 9,000 asylum seekers. And there too, I want to just pause a minute and say, I hope people feel pride on what it means to be a New Yorker and what it means to be part of Health and Hospitals, that while other cities are turning away and turning their backs on people who are seeking asylum, New York City has welcomed them, and Health and Hospitals has provided housing and food and vaccinations and resettlement services and helping people to get work permits. All our hospitals are officially baby-friendly. Our Metro Plus membership is over 700,000 members, and Nurse Distinction was given the prestigious Pathway to Excellence Award at Kings County and at South Brooklyn Health, and at Elmhurst and South Brooklyn Health, then our nurses received the Beacon Award for Nursing Excellence. So those are amazing achievements. In the borough that we're in, want to mention that Carter ranked 4th best nursing home in the state, Kohler ranked 5th, Gouverneur ranked 8th. That's in the whole state, right? Not in Manhattan. That's right, in the whole state. I think another testimony that the public sector can work, that we are able to provide the best of services. Both Metropolitan Hospital and Harlem Hospital were ranked among the 50 most racially inclusive hospitals in America. That's in America. And I wanted to mention we're here at Harlem, that New York City Hospital Harlem launched a campaign to help more New Yorkers living with HIV access safe and effective treatment to become undetectable. Bellevue received a Beacon Award for its coronary care unit. We earned an A Leapfrogs safety grade for Metropolitan Hospital. And they also, they deserve a lot of love and appreciation. In terms of Gotham, I do want to mention that because of ventilation issues in the basement of Sydenham, we needed to close the pharmacy, not something we wanted to do, but we know that pharmacy did not meet regulatory requirements. To make sure that our patients, though, receive their medications, which is what really matters most to us, is we've made arrangements for all uninsured patients to be able to receive their medications at 3 CVS pharmacies with no out-of-pocket costs. We're also arranging, thank you, free home delivery, and of course they can also come to Harlem Hospital. So we're sorry that basement facility doesn't work anymore, but we're determined to make sure that everybody gets the medicines that they need. Okay, with that, I want to move us to the main purpose of the meeting, to hear from all of you. And again, a special welcome to all of our nurses who are here, and we appreciate your coming and testifying, and to all members of the public who are here. I'll turn it over now to Andy, who will go over the rules of the road.
Great. Thank you so much, Dr. Katz. I'm Andrea Cohen, SVP and General Counsel at Health and Hospitals, and I'll be your moderator for this evening. A quick housekeeping item. We are providing translation services in Cantonese, Spanish, and Mandarin. If you require these translation services, yes, please call 212-788-3359 and we can connect you to that service. Also, I think we've just gone past the end of registration for speakers. So hopefully if you were interested in speakers, you have already registered. We have a nice list of, so hopefully you all did. So just a few minutes on why we are here, and then we'll get right into hearing from you. So this is the second in a series of 5 meetings that New York City Health and Hospitals conducts annually across the city's 5 boroughs. The purpose of this annual meeting is to inform the public, as Dr. Katz just did, on some of the important programs and plans of New York City Health and Hospitals, but maybe even more importantly, to afford the public, all of you, an opportunity to present testimony orally, or you can submit testimony in writing to our board about New York City Health and Hospitals performance and programs and policies for consideration by our board. This public testimony, whether you give it orally or whether you submit something to us in writing tonight, will be transcribed and forwarded to all members of the board. Obviously, we have an excellent turnout of board members this evening who will hear you live, but all of it will be provided to all of our board members for their consideration. I'll be moderating the rest of tonight's program, during which I will call members who've registered up one by one to speak to this panel. Just a moment on the format and the rules. So the first thing to understand about this is the goal at this point is to hear from all of you, so there won't be a Q&A and back and forth between you, the speakers, and the members of this panel. We are here to listen to you. And then each speaker, as I call you up, will have 5 minutes of speaking time to speak. There is a light right over here that will help guide you, and so that you know how much time you have left. When there are 2 minutes, it will go green when you begin speaking. When there are 2 minutes left of your time, it will turn yellow, and when your time has expired, it will start to blink, and then it will turn a steady red. At that point, I will do my very best to let you finish your sentence or take a breath, and then I will hopefully gently interrupt you and ask you to conclude your remarks right there and then, and hopefully won't have to do it more than once. But I do understand if you feel like you haven't completed your thoughts, you will have an opportunity to submit more in writing to us. So, but we want to get through everybody's remarks. If I mispronounce any names, please both forgive me, and also please say your name properly so that we have it for the record when I call you up to the podium. Right there is where the microphone is. So we'll now hear from the first presenter, who is Gail Brewer, City Council member, of course, from District 6. Is Councilmember Brewer here? Okay, we knew there was a possibility she might be a little bit late. So I'm gonna move to the second speaker, Keisha Sutton-James, the Deputy Borough President for Manhattan.
Thank you so much for having me here tonight. It is my pleasure and honor to not only to be here to represent the Borough President, Mark Levine, but to be with all of you here on the board, and of course with all of the nurses that are here this evening. This is I should be speaking much more quickly, shouldn't I? Excuse me. This is a special place and a special moment for me personally. I literally grew up across the street from this hospital. I have lots of family who have been in this hospital. On behalf of my family, on behalf of our office, I want to first of all thank the board and applaud the board as well as the entire hospital system for all of the achievements that Dr. Katz referred to in his report out. It is really very impressive. New York City Health and Hospitals, it has much to be proud of. That having been said, I'm also here on behalf of the Borough President to stand in alignment with the nurses and on behalf of nurses and to work with health and hospitals to essentially to remind us all who have been through so much of this of how important they are. Nurses, as we all know, have been on the front lines in the ERs, in the ICUs. They put themselves in harm's way to help neighbors and fellow New Yorkers constantly, and as we've all continued to live through this public health crisis. But nurses are burning out and leaving at a rapid and unsustainable pace because of the low pay and their increased workload that comes as their colleagues have to leave because of the intensity of the work. It's a cycle, but it's a cycle that we can break by agreeing to a contract that pays public hospital nurses at the rate of those of private hospitals. In exit interviews, the number one reasons that nurses are giving for leaving is because of low pay when they are earning up to $20,000 less than private than their counterparts in private sector hospitals. And part of the issue, of course, is that we are filling the gap with the expensive travel nurses that now make up to 25% of health and hospitals nursing staff. So this is not only a health issue, a health crisis, but it's also an equity issue from our perspective because the most vulnerable New Yorkers, overwhelmingly Black and brown New Yorkers, those who I grew up with and still live with every day, and I am obviously, as I said, I grew up right across the street, are the ones that are, potentially receiving unfair treatment if they are not able to get, care from nurses that are not burnt out, that are not stressed out. So unequal pay for nurses leads to dangerous understaffing and unequal care for those patients who have nowhere else to go. So we are here to advocate along with the nurses along with health and hospitals for fair funding, frankly, for New York City public health system. It's a time for investment in our health system. It's not a time for austerity. It's an investment in not just our health system, but our essential workers. And as a matter of racial justice, as well as health equity, we want for health and hospital, the health and hospital system to be paid a fair funding to be able to continue to provide essential care to New Yorkers. Again, on behalf of the borough president, I applaud and appreciate the work that health and hospitals has been, and all the accomplishments that you've been able to achieve thus far. And we just stand in solidarity to try to get even more funding for health and hospitals, and in particular for our nurses, so that everyone can get the quality care that they deserve. Thank you.
Thank you so much for your remarks, and very well done under the wire. Our next speaker is Karen Dixon, who is the chair of the Community Advisory Board for Harlem.
Good afternoon, good evening. Because I signed up last, I thought I was going to be last, so there you have it. Good evening, members of the board, Dr. Katz. My name is Karen Dixon. I am the chair of the Harlem Hospital Community Advisory Board. And I also am the chair of all of the community advisory boards for Health and Hospital. I'd like to thank the board as well as the Health and Hospital system for all of the accomplishments that you have made. I am a social worker in my day job, and I've seen the extraordinary work that Health and Hospital has done for our migrant families. We work with them directly in my organization, and I've seen you provide the care and the nurturing that they need that no other sector has been provided. So I just wanted to say that first. Secondly, I'd like to talk about Mr. LeCon and the Harlem Hospital. Mr. LeCon, since he's arrived at Harlem Hospital, he picked up the mantle of his predecessor, and he's done a wonderful job in ensuring that he addressed the needs of the staff as well as the needs of the community. In addition to that, Mr. LeCon is also very intentional about the information that he puts out and what he's trying to promote. There is a video of Mr. LeCon having a colonoscopy. If you get an opportunity to see that, please do so, because what we know about men of color, oftentimes they don't get the necessary medical tests that they need. And for a leader of a health and hospital system to be able to do that, it has a greater impact than one can say when you talk about it. So I want to share that with them. I also would like to acknowledge other CAB chairs that are here. I see this Donna Gill from Sydenham. We all work tirelessly to connect the work of what happens both in our respective cabs as well as with the community. And our role is to help bridge that information gap. If you have any questions or concerns, please reach out to your cab. If you have issues that you're not certain about, instead of walking away and thinking, oh, no one cares, please try to reach out so we can get your answer. Let us fail before you just write us off. And I want to get that out there to all of you that we are available. Finally, to the nurses. We have seen and we have heard from before the pandemic about the wonderful work that you do. And I think it's important that you know that this body also knows about the wonderful work that you do. And oftentimes when it comes down to money, we forget about that. And I try to operate from a space of grace and know that people are thinking about you. And sometimes as hard as we try, we may not be able to do it, but the effort is going to be there. But I want to say on behalf of all of the cabs, the Council of Cab, the Harlem Cab, the Harlem community, and the communities around the city that health and hospital facilities are located, thank you.
Thank you so much for your remarks. Our next speaker is Donna Veronica Gill, the cab chair for Sydenham.
Okay. Hello, can you hear me now? Hello?
Better. Sounds good.
Donna Veronica Gill, the chair of the Sydenham Community Advisory Board. On behalf of the Community Advisory Board, I want to thank Dr. Katz and the board for your leadership. Our CAB has a wonderful relationship with our senior vice president, Ted Long, and Gotham Health President Michelle Lewis, as well as Sydenham's Deputy Director, Yesenia Pabon, and the Medical Director, Aki, over there, and our Director of Nursing, Denise Fullington. They encourage us with an open door policy for communications. I just want people to know about the clinics. Gotham clinics are where we come from. We work very hard. Sydenham was actually the first clinic to have COVID testing in Upper Manhattan when it started. And we had to notify the community because the community kept asking, where can we get tested? And I'm like, come to Sydenham. That's the place to do it. So, you know, we at Sydenham, we have 3 health centers. We have one at St. Nick, we have Sydenham, and we have one in Dykeman. So we're the largest public ambulatory care provider for medical, dental, and primary care available in the neighborhood. And at St. Nick, we have DEC, which is the Developmental Educational Center for Children with Disabilities and things like that. So that's really something that I wanted to highlight. We are in Central Harlem, West Harlem, and Washington Heights, and Inwood. Currently, we operate 4 school-based health centers. And at these centers, any child who attends the school and whose parents or guardians consent can receive care, and regardless of insurance or immigration status. And it has been proven that school-based centers lower school absenteeism, parents and guardians' time away from work, and they also lower chances of emergency room visits and hospital visits. If a child has a chronic illness or suddenly gets sick, a school-based center can assist with them. Dr. Katz mentioned our pharmacy closing, which closed on March 31st. Due to inadequate space and aging infrastructure of the building. This closure adversely affected our uninsured patients who received their medication through the pharmacy. To avoid interruptions, there's been a plan. They have access to medication. Sydenham is working on various options. Contacting CVS, as Dr. Katz mentioned, offering mail order and home delivery. We're also providing Metro cards, transportations for the patients to get to the CVS, to the pharmacies. So, you know, Sydenham wants to remain a point of contact to assist our patients in order to get their medication. We're going to conduct a walkthrough with H&H and the elected officials just to see the feasibility of having the pharmacy place someplace else in the building, if that's possible. But we are talking to the community, we're talking to the electeds, and we're going to make this work. So I appreciate being able to speak. I appreciate the partnership and the nurses. We really appreciate you because without you, nothing actually happens. And we're definitely going to be working for you and working with you. And we appreciate our partnership and look forward to connecting Harlem, Northern Manhattan residents to healthcare and resources that they desperately need. Thank you.
Thank you. Thank you very much for your remarks. Our next speaker is Jessie Kravitz, the Community Coordinator for the Mayor's Office to End Domestic and Gender-Based Violence.
Hi, everyone. My name's Jessie. I first want to thank the nurses for all you do and the care you provide. But I am here today to talk about domestic violence. I'm a community outreach coordinator for the Mayor's Office to End Domestic and Gender-Based Violence, and we run and operate the New York City Family Justice Centers. As you all know, domestic violence continues to be a public health crisis, and we want everyone to know of the services that are available. So at the Family Justice Centers, you can get free case management, legal assistance, help with benefits, help finding shelter, food stamp help, assistance with childcare. So it's a holistic, client-centered approach to help survivors. And you do not need proof of the abuse. You just need to show up, and it is confidential and free care. I also want to just say that the Family Justice Centers operate in every borough, and they are open Monday to Friday, 9 to 5. I left information with the addresses and numbers at the table out back, but there is anyone can go, whether, regardless of gender identity or immigration status, and anyone as young as 13 can also go without parental consent. And then the last point I want to make is that at our office, we have a healthcare working group where we gather different members of health in hospitals and private hospitals to talk about how to best care for patients who are victims and survivors of domestic violence. So if you're interested in that, please contact our office. We'd love to get more people involved in these conversations. Thank you.
Thank you very much. Our next speaker is Sonia Lawrence, the new president of the NYSNA Executive Council at New York City Health and Hospitals.
Thank you for allowing me to address the board. And thank you, Dr. Katz, for highlighting all the great accomplishments of H&H. I've always thought, and I always know that at H&H, we do great work. My name is Sonia Lawrence, and I've been an ICU nurse at Lincoln Hospital in the Bronx for 28 years. I am also the president of NYSNA NYC Health and Hospital Mayoral Executive Council. Our public hospitals are the backbone of healthcare in New York City. We have been on the front lines of the COVID-19 pandemic. We have lost patients, colleagues, and our loved ones. But without New York City public hospitals, we would have lost so many more. We have provided life-saving care to more than our fair share of COVID-19 patients. We got New Yorkers vaccinated, and we helped get the city back on its feet. At H&H, we are proud to care for all New Yorkers, regardless of immigration status or ability to pay. But we are always asked to do more with less. I am worried about the future because it seems like we have been even less funded and fewer nurses to care for the most vulnerable New Yorkers, unless the city acts now. As many of our experienced nurses are exhausted, burnt out, and given up. They've retired or left H&H, the mayorals, for better pay and working conditions in the private sector. We have some units where the most senior nurses who are in training are mentoring new nurses. We have some units where the most senior nurse who is training and mentoring new nurses have only 1 year of experience. Nurses who have had minimal hands-on clinical training because they graduated during the COVID-19 pandemic are being put in charge. That's not fair for our young nurses who are thrown into the sea and told to sink or swim. And it is not fair to our patients who deserve experienced nurses at their bedside. When I was a new nurse at Lincoln in 1994, I was on orientation for 3 whole months. They required new nurses to work on the floor for 3 years before moving to emergency department or ICUs. That level of training and quality that has gone out the window because turnover is so high. H&H needs a robust program to retain its senior experienced nurses. In order to get quality care, you need trained and experienced nurses at the bedside. To retain nurses, H&H needs to improve the working conditions and pay. The safe staffing ratios in our contract. Many units at Lincoln and other public hospitals throughout the city are regularly understaffed, and this leads to burnout and nurses leaving the bedside. It also compromises patient care. H&H and mayoral nurses need fair wages. Exhausting ourselves or sacrificing time with our families, working 2 or 3 jobs to afford living in the city. The gap between our pay and the private sector nurse pay is only getting bigger and more unfair. The difference in annual salary between public and private sector New York City nurses used to be about $14,000 a year. And with the new private sector contract, it will be more than $19,500 per year. A lot of incentive to leave the public sector that desperately needs to hold on to its experienced nurses. H&H and mayoral nurses stay because we are committed to care for our community, for all New Yorkers, including the patients that the private sector does not want to care for. But we need some incentive and some equity too. Respect public sector nurses and our patients. H&H is our healthcare system. Let's make sure it continues to be there for us when we need it, with enough nurses for quality care for all. Thank you.
Judith. The next speaker, thank you for your remarks, is Judith Kutchen, first Vice President for NYSA.
Oh, so just a reminder to you, Dr. Katz, on the accomplishments. Woodhull received the gold, Beacon Gold, and the first hospital in Brooklyn that received it. Just want to point that out. Hi. Hello, everyone. My name is Dr. Judith Kutchen. I am a registered nurse at Woodhull Hospital for the past 31 and a half years. I am also the first vice president of the New York State Nurses Association, AKA NICE. Now, we want to thank you for providing this forum, this platform for us to discuss and bring attention to our concerns. The magnitude of our problems, the two-tier healthcare system in New York City, a system of healthcare as privilege, not a right, and some of the healthcare facilities exist. And by the way, many of the poor in New York City are working poor. We don't want our patients or staff to be victims of a multi-tiered system. We want them to remain in H&H, where we provide quality care all the time. In order to do that, we need to get safe staffing, we need parity. Don't get me wrong, this is not about money. This is about being able to have comparable salaries that will help us recruit and retain quality nurses that will be like us, dedicated to the cause for health in hospitals. Listen, it is well known that H&H anchors the entirety of our city's healthcare system. I believe it's the world. By ensuring that everyone receives a quality care regardless of their ability to pay, which is why we are here today to express our concerns regarding staffing and pay parity. Think about it. If we will be able to have a consistent hiring practice that will increase staffing ratios, this will increase access to care for our patients, their families, and the community. I am one of those lifelong health and hospital patients. I was born in Kings County. I am a patient at Woodhull and at Elmhurst Hospital. And as a patient, I see the effects myself of the short staffing. The wait times, I wait my turn. When I do go to the facilities, I do not skip the patients, I wait my turn. But I see that the wait times are so long. Some patients walk out and it boosts me up to an earlier slot. I want to make it clear that I am in no way suggesting that we only concerned about pay raises. It is about recruitment. Again, it is about retention. It's about staffing that will increase the resources needed. It's about taking $150 million that was open to the travel agency nurses and invest in our system. Let us be reminded that H&H lost over 2,000 or more nurses. Dr. Katz, you stated yourself at the City Council budget hearing that the network spent over that $150 million. Let's be logical. Allowing pay parity to increase staffing ratios will reduce costly hospital readmissions, improve care coordination and optimize care, save our valuable, well-known healthcare system, our beloved health and hospitals. And to wrap up, as the frontline nurses, we know the importance of funding our public health infrastructure to allow nurses and other caregivers the tools needed to deliver high-quality health care to all New Yorkers with compassion, dignity, and respect. Safe staffing saves lives. Parity will increase the staffing, and that will also increase recruitment and retention. We love health and hospitals. We want it to exist forever. I will be here until it closes. So just so we'll know that safe staffing saves lives. Safe staffing.
Thank you very much. The next speaker is Marina Alexander, an accountable care nurse at New York City Health and Hospital.
Good evening, all. and thank you for the opportunity to address the board. My name is Marina Alexander, and I'm a proud member of NISNA. I have been working here at Harlem Hospital for my entire nursing career. And I'm here tonight on behalf of myself, my patients, and my fellow nursing colleagues. I love Harlem Hospital. I came to Harlem Hospital Center as a young and eager graduate nurse to work with people of my community. I wanted to make a difference in their lives of the most vulnerable and underserved population. I worked here at Harlem Hospital on the med-surg, ICU, and labor and delivery units as a staff nurse. I also spent many years as a nurse educator on the labor and delivery and med-surg units. And now, as you said, I work as an accountable care manager on the geriatric units. During the height of the pandemic, I helped onboard hundreds of agency nurses. They came in to Harlem Hospital by the busloads. And it didn't matter if it was day or night. I worked all towards, and very often I was by myself, the only educator getting the job done. I also saw many deaths of patients and co-workers. Even with the help of the agency nurses, it was still very chaotic, but we soldiered on. We were called heroes, but truly we did what all nurses would do in the same circumstances. I'm always so proud to say I never caught COVID, and God and my masks were my very best friends. I see Harlem Hospital go from a robust hospital filled with nurses from different generations, working together. Now I'm seeing new nurses that are here today and sadly to say, gone tomorrow. They're here for the meantime as they wait for a better offer in the private sector. It's not just the new nurses though. The problem is that we can't keep up with the revolving door of nurses. I literally have a nurse telling me that they're leaving, or I'm hearing about a nurse leaving almost every week. I mean, who could really blame them? They're looking for better opportunities for themselves and their family. They say the public sector hospitals can't compete, but we must, because we can't sustain the way we are going now. The patients of Harlem Hospital and the public sector hospitals deserve nurses that can take care of them without rushing and feeling overwhelmed. We nurses deserve a place to practice safely and efficiently. A nurse that is happy and feels joy because he or she knows they're doing their very best to take care of their patients, just like I did in the old days. My colleagues and I deserve to be fairly compensated for our skills and knowledge. In the words of our mayor, Eric Adams, parity is not charity. The private sector nurses are here working for an agency. I can tell you Harlem Hospital nurses are well trained and they can work in any hospital. We spend so much time, money, and energy training nurses, and soon after their orientation is over, so is their employment. Really, what's keeping them here? The public sector hospitals can't afford not to increase the nurses' salary because they will be paying for this disparity one way or another. The Health and Hospital Corporation is seeing red and will continue to see red because we are hemorrhaging and a Band-Aid won't fix it, but pay parity will. Good people of the board, I appeal to you all. Please examine your conscience, then do all that you can to help the registered nurses of the public sector. Thank you.
Thank you very much for your comments. There is Stacy Ann Reed, staff nurse at New York City Health and Hospitals.
Hi, my name is Stacy Ann Reed. I'm a nurse here in Harlem Hospital for the past 6 years working in the emergency room. Thank you for giving us this opportunity to be able to address you guys. I keep it very short. We are working in a place where we are consistently placed in unsafe work environment because we are persistently understaffed and burnt out. Unsafe staffing means unsafe patients. We are understaffed because H&H is a training ground. It's a training ground for private sector nurses. They come in, get 6 months training, and head off to the private sector. And that creates a constant revolving door. And we are left carrying the burden. Agency nurses are not much better. They come in being paid twice what we are being paid and not being able to perform up to standard because they're inexperienced and unable to be floated where they are most needed. And again, we are left to do our jobs and theirs. Same city as private sector, and we're working harder because of these conditions, and we're demanding pay parity. Pay parity is not charity. I repeat, parity is not charity. We are not begging for a handout, and it is a shame that we have to stand there, literally groveling and begging for what we have already earned. Not so long ago, we were called heroes without capes. Pay mortgages, these heroes pay bills, these heroes have children in college. And while we were being heroes, we were in the eye of the storm. We provided VIP care while many were traumatized watching our colleagues suffer and fighting for their lives, literally. We watched people in our communities who come into this hospital very frequently never leave. Died without family, without any support, and we were there for them the entire time, all the way. In every moment of their lives being here in Harlem during that time. If you all don't know these heroes, pay bills, I'm asking you right now, you be the hero for once. Be the hero and stand by us and do what is right. Thank you.
Thank you. Thanks for your remarks. I think since the auditorium is large, I'm going to give 2 names so that you know when you're coming next. So the next speaker for right now is Crystal Sims Murphy, a nurse with the Department of Oncology and Hematology at Jacobi Medical Center. And then after that will be Ria Briggs, just so you can be prepared.
Evening. Thank you for this opportunity to speak. As a nurse practitioner in hematology and oncology, I'm heartbroken because I take care of a very vulnerable population. Sickle cell patients that are in the emergency room waiting for pain medication or waiting to get triaged for 45 minutes or more, I cringe. They call me, they page me, they tell me how much pain they're in and that they cannot get the care that they truly deserve at that time. This is not the run-of-the-mill patients that they come in on a frequent, they're not frequent flyers. These are patients that are in severe pain that only call me when they're desperate. And it hurts me because they don't understand that they're not forgotten or unprioritized. It's just that there are not enough nurses to care for our bustling emergency rooms with one nurse to 20, 30, 40 patients. Or worse than that, imagine being a patient in the ER and hearing level 1 trauma over our loudspeakers. That could be a heart attack, stroke, horrific car accident, a gunshot wound, or stab victim, and simultaneously happening. H&H trauma facilities pride ourselves on taking care of the critically ill, yet our monetary value and worth are not equal to the care we provide. What about my cancer patients who are nervous, distrustful of the healthcare system, not healthcare literate, and cannot afford their own chemotherapy? Those are the patients that I see every day. It gives me great pride to be able to be the trusted provider to educate and guide these patients that look like me and are reminiscent of my own family, providing them with compassion, patience, and dignity. When that same patient's eyes glisten when they see me during that clinic day, and they update me on the good, the bad, and the ugly of their treatment or their personal life because they trust the care that we give. It pains me to think that I have to choose between these meaningful relationships and the value of my work. Choosing between my purposeful career. I've been at Jacobi for 16 years. I started there as a PCA while I was in nursing school. Went to nursing school, became an NP, and still there because of the patients that we work with. I have to choose between my career and how to balance my checkbook, taking on per diem jobs and overtime to make ends meet. With most of our nurses being the same demographics as the patients that we see, why shouldn't we have the health equity for our patients and ourselves? We train nurses, we train residents, we train fellows, we train anything that can walk and talk and breathe. Yet still, we cannot train enough nurses. We cannot afford to train nurses for 3 to 12 months and they leave with a wealth of knowledge for a higher paying job. There's a decreased return on investment. It is disgraceful and an outrage as the aging nurses are entitled to retire at some point. However, who shall I pass my baton to if we cannot retain these nurses in the current state of affairs? There are so many wonderful people that work in H&H, and we cannot afford to lose them because our patients are the center of why we are here. Our patients that look like us should not get less treatment because we don't have the proper staffing. My family members come to H&H, not because I work there, but because I know that they can go to any H&H and get dynamic care, efficient care. However, if I have to tell them they have to go someplace else because there's just not enough staffing, that's a slap in the face to them. It's a slap in the face to the communities at large, and we know that we can do better. How we're gonna do that is to get pay parity for all of our nurses. Thank you.
Thanks for your remarks. The next speaker is Ria Briggs, also a member of NISNA, and after that will be Sean Petty.
Good afternoon, good afternoon, good afternoon, good afternoon, good afternoon. Dr. Katz, how are you doing today? You and your members, they're always present, always in person. We depend so much on you. My name is Ria Briggs. I'm from South Brooklyn Health, which was known as Harlem Hospital. And today is a very special day for me because a man that was stabbed in Harlem at the book, signing a book, he was treated right here. He saved his life right here. If he had sneezed just for once, he would have died. And that is the history that Harlem Hospital has in terms of over the years. The man said in Washington on the march, he said, it is always, the time is always right to do what is right. The same man said that, and that man is a great man. He was assassinated today, a day like today, the 4th of April, 1968. That man is Martin Luther King. We talk about, I heard a speaker talk about women discrimination, women abuse, and the public health sector, the nurses are primarily women. So, what Dr. King stands for, he stands for the rights of human beings, civil rights, human rights, all rights, justice, economic, social, all the rights he stood for. And the same thing that person is trying to convey, that the women is precious in our society. A mother is all that we have, you only have one. And as these nurses testify here, some of them are the only breadwinner in their families. Now, there's a critical race theory. I don't too much subscribe to the theory, but the theory says this. The theory said that in terms you have efficiency and we have immorality. And efficiency is driven by immorality, which is a negative motivational factors, which means that it's based by abuse, it is driven by taking away of privileges, it is driven by whatever it takes to lower the standard of management, to drive the nurses to do the extra bit, to always be efficient. And what we have seen that culture creeping into H&H, and that is not what the H&H I knew when I joined H&H in 1995. I went to war about 3 times, and as a soldier, I tell you what, motivation, teamwork, you can't beat that. And priority pay is something that will get us, H&H, to that level of magnet status. So the entire H&H could add magnet status to every single hospital in the system. And I read one of your acknowledgements in a medical book, Dr. Katz, and I acknowledge that your vision is to make sure that H&H stands out as a successful system among the different or the various healthcare systems in the entire world. The mindset that we should have is to make certain that H&H invests, constantly keep investing in nurses, because nurses is what is keeping our South Brooklyn new annex facility from opening. That's one of the causes. We don't have enough nurses. We cannot afford to open the facility without sufficient nurses. So I would just like basically tell you that we must have positive motivational factors in terms of drive efficiency, and those positive motivational factors, priority pay, build teamwork, and safe care in the environment. And I would love you guys to make certain that that is what will come to fruition in the near future, because NICE put together a very intensive package in terms of this negotiation. Every single day is well thought out. It's not to rob the city money. It's not to take away the privileges of the community in terms of their economic power. But by God, we just preparing for another possible COVID pandemic. And that is where we want to be. We want to always be ready, combat ready, I would say, combat ready for H&H. Thank you.
Thanks for your comments. The next speaker is Sean Petty, member of NISNA, and after that is Ana Castro.
Everybody, my name is Sean Petty. I'm a pediatric emergency room nurse at Jacoby Hospital. I'm really glad Mr. Briggs mentioned commemorating this day of Dr. King's assassination, not only because he was a patient here, but because the fight that he was supporting that day in 1968, which a lot of people may not have remembered, was a workforce in that city was almost exclusively Black workforce who were fighting for human dignity, were being paid as second-class citizens. They were sanitation workers. They were public sector workers. They were not being paid like their private sector counterparts who were white. Generally speaking, Dr. King was assassinated because he started speaking out about broader issues of inequality in this society. He went from speaking out about Jim Crow and apartheid to speaking out about the entire economic system and how unfair it is and how much profound inequality there exists. And then he started to support union struggles. He started to support struggles like the sanitation workers strike in 1968 in Memphis. And he knew that because he was speaking out on those issues, his life was in greater danger. The speech that he made before he was killed, he said, "We are going to make it to the promised land, but I may not get there with you." He knew what was coming down the pike, but he still decided to go to Memphis. He still decided to speak publicly, even though he knew his life was in danger. So I'm incredibly grateful that we can commemorate that, but I do have to say that 55 years later, we are still in a situation where there is public services that are in an apartheid kind of situation between public and private sector. We have second-class services. We have we have disparity between the public and the private sector in terms of how we are being valued. And it's not a mistake in terms of you just follow the money. Where does the funding come from? Who gets it? Who makes those decisions? The slogan of that 1968 sanitation worker strike was, "I am a man," which is a precursor to Black Lives Matter. Right? And we are basically, obviously, still fighting that fight today. Right? The amount of resources that get put for some people versus others is still racially determined in this city. Some of us, even those of us who happen to be white and male, like myself, but who worked in this system for 15 years, see the impact of that every day. We have lost our work families in this system. 15 years ago when I started, the first 10 years, I could count the amount of nurses that left my unit on one hand for 10 years. Now, if 5 nurses leave in 6 months, that's a good 6 months. I have nurses in my unit who have left and come back to work as travel agency nurses in the same unit. 3 of them. How can that continue? How can that state of affairs continue? How can our families be our work families? And we depend on those families in our units to provide pediatric trauma care to the Bronx. We're the only pediatric trauma center in the entirety of the Bronx in southern Westchester County. To continue to provide adequate pediatric trauma care, we need to actually have people we can trust around us. We need to have experienced nurses. They've left. There's only 5 of us left. So we have made, Dr. Katz mentioned at the beginning, there's going to be progress that we made. And there's certainly progress that we made in the last 55 years. But there's a profound hole, there's a hidden crisis that we need to break out into the open, that we need to resolve in this moment. This is the year. This is the month. But we need to resolve this crisis. And I'll just say the last thing is that the nurses in this room will stop at nothing to make sure that this happens this year.
Thank you for your comment. The next speaker is Ina Castro, a staff nurse at Kings County, and after that will be Beatriz Lugo. Ina Castro. Are you here? If you could just raise your hand. No. Okay, we're gonna, next speaker then will be Beatrice Lugo, Accountable Care Manager at New York City Health and Hospitals, doesn't give the facility.
I just want to thank you all for allowing us to speak today. As a patient, I'm talking as a patient because as a patient, when I came to this country, I am an immigrant because I came from Puerto Rico. Language barrier and everything. Nurse, yes, but I couldn't service my service here because my license wasn't good here. So when I decided to come to New York City, the first hospital that serviced me was Lincoln Hospital. And when I went there, I said, you know what? When I get my license, I want to be working there at Lincoln Hospital because of the way that I was treated. So it doesn't say that us nurses from the city hospitals are no worse than any nurse there. We're as good as any nurse in the private sector as us. So when I came, even I have 4 babies. All my babies are Lincoln baby because even as a nurse, when I decided to get my license, my first step was Lincoln Hospital. They took me right there and then. I worked there, and at 12:30, I was already a staff there, and I went on orientation. I decided to say I'm going to work for 2 years because you know what? Yes, there's other settings that I can get paid more. But you know what? I never looked back. I stayed. I've been here 28 years, 10 at Lincoln, 18 at Harlem. I never decided to leave. Like you said, Ms. Barbara, you're from the board, and you say, I don't want to leave the board. I don't want to leave H&H, but I do deserve to get treated the same way as any nurse out there that are getting $20,000. If you look at the city hospitals, the nurses that are here are longevity nurses. They're the ones staying. They're the ones working hard. They're the ones burned out. We need to be treated the same way as anybody else because we do the same work, maybe even more. Because like me, I was an unserviced patient. I had no insurance. I came here on a tragedy event with nothing on my back and 9 people on my family. I was the person that was the speaker for my mom with the little English that I know. But guess what? I made it thanks to New York City Health and Hospital. And I want to stay. Before, when I left in 2005 to come here, there was nurses working in their 70s and 80s that didn't want to leave, and they can't take them out. But now it's not like that. You need to make sure that we get what we deserve, and that means the pay and the ratio.
Thank you for your comments. Now moving to my next list. Next speaker is Judy Wessler. Describes herself as a private citizen. And after that is Alicia McMyers. Take your time.
Hi.
Hi.
So I'm very supportive of the nurses, but I also wanted to speak as a consumer and somebody who's been supportive of, and I will call it Health and Hospitals Corporation, for 40 years. And I just want to say we have a job to do in order to make sure that nurses and everybody else get paid the way they should. And that's, there is a thing called safety net hospitals, and I'm very proud of the fact that I worked very hard to get that into state legislation. And unfortunately, the state doesn't always do what they're supposed to do to fund safety net hospitals. So it's our job, and HHC has been part of this effort. Michelle DeBacco has been actively involved in a coalition effort. NYSA has been in and out and hopefully will be back in because we need to fight for the money that the public system deserves. And it's not charity, it's it's payment for services. And by doing that, there should be money not to pay the big guys more that they do in the private hospitals, but to pay the staff, and particularly those frontline staff people who take care of patients, like me. I'm a patient at Gouverneur when I can get an appointment. It's not funny, but you know, whatever. So, but we have a job to do. We have a fight to you know, be there in Albany, in City Hall. I don't quite feel as confident as Dr. Katz does that the city will come through. I think it's our job to make sure that it does, but the big money is Medicaid and it's at the state level, and we've got to be there fighting. But in order for me to keep doing that, because I'm really ticked off, there's a thing called Gotham that runs the ambulatory care facilities, diagnostic and treatment centers, all the different names that we have. And they have been ignoring the community advisory boards at the DNTC facilities. And I know I wrote to Dr. Katz about this, and Ted Long, Dr. Long, who's wonderful, and I and others have been talking, negotiating to make sure that, you know, that wrong is right, is righted, or whatever the words should be. And hopefully we're doing well with negotiations. But I think, you know, it's staff that deserves respect, but so do the patients like me that need appointments. And people who volunteer their time on community advisory boards and in the auxiliaries and other also deserve respect and to be treated that way. And that's a very key piece that I hope will be ingrained. I know that my dear friend Barbara Lowe knows that, and hopefully expresses it at the board level. So I thank you for this time. I do hope the salary raises come through, but it can happen through our fighting for more money where it should be going, not to the big guys that are, you know, $10 million salaries, et cetera, which is disgusting. So I'll stop rambling because my back hurts. Not for any other reason, but thank you for the time. Yeah, I need to know.
Thank you for your comments. Next speaker is Alicia McMyers, Accountable Care Manager at Health and Hospitals, and then after that will be Arlene Phillips.
Good evening, everyone. Thank you, Dr. Katz. Thank you to the board. Thank you to my fellow nurses for coming all the way up to Harlem. I want to tell you about a labor of love. I'm a Bronx girl, born and raised, and I became a nurse. I became a nurse because my grandfather was a nurse here. My whole family was born here. My husband was born here, my mom, my dad, my two uncles, and my auntie. And I'm a Morris Senior baby, although it's closed. Right? So I became a nurse. And while this was not my first job, this was my second job. And here is where I stayed. And I'll tell you why, because I trained from the best of the best to work in the best of the best areas to be one of the best of best. And that's courtesy of Health and Hospitals. I've worked in critical care as a staff nurse. I loved it. I still love it. I became a nursing supervisor and worked in critical care and learned emergency services, and I loved it. I also rose through the Neisner ranks. I was a delegate, I became a membership chairperson, and I love greeting all the new nurses. Love it, to tell them about the experiences that they're gonna have right here in Health and Hospitals. Now an accountable care manager, like my fellow nurse Marina, like Lugo. And we see patients who come in with complex medical issues. So we have to coordinate their care, make sure their insurance is right and they're gonna pay for the stay so that they can go home, that they have safe discharges to go home where they wanna be. Sometimes they have to go to rehab, and that's okay too. But we are here to serve the community. We are here to love on them because this is where we are. We could be anywhere. We could go anywhere. We could get any salary that we want to, but we choose to stay here. And it's different now. When we were trained, when I came here in '93, orientation was a lengthy process. That doesn't happen now for our new nurses, unfortunately. They are thrown to the floor with censuses of 35 and 40 patients. And as the LBU vice president here at Harlem and the Health and Hospitals and Mayoral's vice president, I get text messages all the time. This weekend was crazy. It was only 3 of us and we had 40 patients, 2 texts on the floor. We had to cover one-to-ones, or we had to cover for breaks, or we didn't get a break. What do you say to that? What do you say to the new nurse who says, I've only been here a year, but I'm going, I'm leaving? It's hard. I'm just gonna say this, and I know we talked about Martin Luther King and his speech he made on April 3rd of 1968, and as today is his assassination anniversary. And I just wanna say to the board and to my nurses, as he said to the sanitation workers, you are demanding that this city will respect the dignity of labor. So often we overlook the work of those who are not in so-called big jobs. But let me say to you tonight that whenever you are engaged in work that serves humanity and is for the building of humanity, it has dignity, and it has worth. You deserve pay equity. You deserve the resources that you need to provide quality care for all New Yorkers.
Thanks for your comments. The next speaker is Arlene Phillips, staff nurse. Arlene Phillips. The next after that will be Allison Gordon.
Good evening. I am dressed to also leave and go on the floor. Thank you. Thank you, Mr. Chair. I applaud all the achievements that's celebrated by HHC. I am Arlene Phillip and a new joiner as of June 2022. I work the night floor on a 55-bed floor on the 12th floor. It's a med-surg unit with a high daily turnover of admissions and discharges, 20 to 25%. I sometimes wonder if it's the patient factory. I work tirelessly without my mandatory lunch breaks because of the admissions. When I'm ready to take a break, admission comes. What do I do? As you know, city hospital nurses cannot strike, hence the limited headcount as we see here. My main concern is the playing field that's established here as a training ground to graduate to the private hospital due to low pay. You are incurring the training costs for private. How does it benefit HHC? We appear not to have a float pool. We short already on the staffed floors to float staff to staff other floors. The dynamic of the night staff on my floor is agency. It is almost to say to me that my benefit cost to staff is $1,000 per week. Given the difference to the staff pay versus agency pay. If that is true, and I have not seen the numbers, and if it is not true, can you fund the parity account and instead of the charitable allocations? I question every day, will I stay? Mr. Chairperson, give us parity to retain nursing and maintain safe patient care. When there is high patient to nurse ratio, it takes a long time to get to frustrated patients. They are in pain and they are going to assault nurses. This is what I go through on the 12th floor. Some days are better than others. Some days staffing is better than others, but I can count on my hand for the night tour since January to now, how many times I was at ratio. Our managers, every morning when they come in, they tell us thank you because they know the burden that we feel. But thank you is not enough. Thank you is not pay. Doors permanently than a revolving door. Open doors permanently, where persons, we want to stay, but we are challenged at heart, knowing that we are overburdened, and we wonder, are we of any value? Give us parity, I beg you. Thank you.
Thanks for your comments. The next speaker is Allison Gordon, and after that is Mary. Allison Gordon. Oh, yeah, I'm sorry, thank you.
Hi, good evening, everyone. My name is Allison Gordon. I'm a nurse on one of our med-surg units, the 14th floor. I've been working here, this month will make 5 years that I've been working at Harlem Hospital. And I must say, since the first day I've set foot in this building, staffing has been an ongoing issue. Some days are better than others, but for the most part, it's a huge issue. Our nurses and patients deserve better. With staffing the way it is impossible to care for our patients the way that we know they deserve to be cared for. Just a few weeks ago, I remember staffing was so bad that weekend that one of our nurses at the end of her shift, she literally was in tears because she gave all that she could and she knew that that still possibly was not enough, but that was all that she could do. Do we expect to retain our nurses when they are constantly being overworked and underpaid? Nurses are leaving the city for better paying jobs. And if we don't start paying our nurses more and adhering to the ratios, we'll continue to hemorrhage nurses. We are sick and tired of working multiple jobs just to make ends meet. It's a slap in the face when we have to work with agency nurses and we're doing the same jobs, but we're being paid significantly less. I heard of having farewell parties for my coworkers that are leaving for better opportunities. We have to do better. We have nurses that they're not even finishing orientation. We have nurses after 6 months, they're gone, let alone 1 year. If they're here for a year, we already know that a party is coming. They are leaving. So please, pay us more. We need pay parity. Thank you.
Thanks for your comments. The next speaker is Marion Parkins, and then after that, Florida Gilmore. Marion Parkins from NISA.
Good evening. Thank you, Dr. Katz, for updating us on all the successes. But I'm telling you, if it wasn't for the nurses, where would all these successes go? Okay. Our nurses have seen it. I would start from HIV time until this COVID. They went into it. It was like a tsunami, and they went into it. I saw my colleague, they made their PPE, plastic bags, garbage bags, and made plastic facing to go in to take care of their patient. We have to get pay parity. We demand pay parity. We demand safe staffing for our patient. Our patient is suffering. They're not getting that high quality of care that we're supposed to give. Our nurses are coming in and leaving for better pay. We have to do something even now. This is too long. And the hospital here in Harlem, and I walk the floors. My heart bleed for my colleagues, especially on the medicine floor. We can't have a floor with 50-odd beds with 7 nurses or 8 nurses. Where is the care? And they have to do bladder scan, do all the blood draws, do everything. Our nurses are getting assault on the floors too, because they have to deal with psych patients. I have nurses that I'm mentoring who called me from home and said, Miss Parkins, I cannot take it. I have to leave, because she went into the room to medicate this psych patient. Luckily, that she was not raped. And that patient grabbed her, pushed her to the wall, pushed her on the ground. She was so scared, even at home speaking to me. She was trembling. Dr. Katz, we have to do something better. This contract is taking too long. 5 of us is leaving. I'm begging, but the contract is taking too long. And there's hemorrhaging, and the blood bank is empty. Okay. We need our nurses. We can't just train them every time. We are losing money. We are losing money. We have to do something immediate. It's imperative. We need parity. We demand safe staffing right now. We don't, because we are we are losing our nurses. And we just have to think, maybe make sacrifice to get us where we want to go. I'm asking you, I'm begging you, please, we need parity. We demand safe staffing. In our last contract, we have safe staffing. It was never respected. Even in the ICU, they want to leave one nurse or asking nurse to work in this unit and then work in that new unit. They've been floated 4 and 5 hours after, 2 and 3 places. Respect. We need it also. Respect. Respect. That's why some of our senior nurses have gone, because there's too much disrespect. I see our nurses now leaving 9 and 10 o'clock in the morning. I feel it. I feel it for them. Let's say they have somebody to go relieve for their babysitting or something like that. Our nurses are dedicated to our Black and brown communities. Immigrants, we have asylum seekers here now. We better pray that there is not another tsunami because we need H&H. Please don't let H&H go on the run aground after your thing because you're working hard. We need parity. We demand parity. We demand safe staffing, safe nurse to patient ratio so we can take care of our patients. Thank you very much.
Thanks for your remarks. Next speaker is Florida Gilmore, and after that is Tamani Tomlin.
Thank you.
RN.
Good evening. Thank you for this opportunity to gather together, to speak, to talk, to express. My name is Gilmore, first name Florita. I am a accountable care manager on 13th floor. I've been at Harlem Hospital for 20 plus years. I think this year I make 22 years. I've been a nurse for, I think, 30 years. Thank you, God. Serving, sacrificing, working hard, sweating, crying. Now I'm bleeding. My patients are bleeding. This is an outcry. This is a life and death matter. Did we not see COVID? Did we not see the sick, the suffering, and the dead? Did we wrap bodies? Did we overpack those trucks? The frozen trucks, those trucks were overflowing. And who packed and wrapped those bodies? Who watched those patients suffer and die? Holding their hands when family members could not be in those rooms with those patients. But our heroes and our sheroes were there morning, noon, and night. Couldn't take a break, couldn't go to the bathroom, getting urinary tract infections because they can't release themselves in a timely manner, can't take a lunch break, can't just feel human to do the job. We don't feel safe working with no hands, with no staff, no hands on deck. Dr. Katz, do you hear us? Let me give you, and the panel, let me give you a depiction of what I see on the floors. I don't do patient one-on-one care anymore because I'm an accountable care manager and I'm coordinating care and doing the transitional part for the patients to have a safe transition from hospital to community. But when I go into the patients' rooms, sometimes there's nobody to feed them. And I'm gonna tell you, I'm talking from experience, I gotta feed that patient. Patient is blind, not enough hands on deck to go around to feed the patients, to change the patients. The patients are ringing the bell, not enough hands on deck to get to the patient. Not because the nurse don't wanna go in a room, and not because she didn't hear the call bell, because she's with the patient suctioning the one on the respirator. She's short staff. No one is there to troubleshoot equipment that's not working. Nurses have had it. I cringed when I saw Montefiore, the private sectors outside striking in the cold rain with their children, begging. No more begging. We demand what's rightfully ours, and that's pay parity now. Enough is enough. COVID declined a little. I do not trust it. We may see that day again. We don't want to see it, but we may see that day again. We need to encourage more nurses to enroll in nursing schools. We need to keep our nurses in these hospitals. We need to encourage them to want to stay. I came here in 2001, and I started off on 13 medicine. And I remember one evening, I'll never forget it, it's like yesterday. I was the only RN with one LPN. I had one side, she had the other, and we had to make it work. And we did it by God's grace. Thank you, Jesus. We did it. But let me just say this. The cost of living is on the rise. It's not going down. It has gotten worse. Remember this, the gas prices the other day was off the chain. It was just going through the roof. And we had to make it work. Yes, I work a second and third job too when I can get to it, when I'm not too tired. But I'll tell you this, we have to come to equality. It has to happen now. We need it. We are desperately at that point, at the breaking point now. We can't live like this. Some folks say RNs make too much money, they make enough, be satisfied. If I make 6 digits come down to 5 digits, I gotta live on that. My salary is cut in half. Now I gotta go out there and make the rest to make up for that salary. This is not this. Also, I've served several staff members in Harlem Hospital, and on those days, they were looking for VIP service, and they got it. Our patients deserve VIP service every day. Thank you.
Thanks for your comments. Next speaker is Tamani Tomlin. It's Nizna.
Thank you, and hello, everyone. Hello, fellow nurses. This is my first time actually coming up and actually speaking on behalf of the nurses and myself, but I felt like I needed to now because we're in a really serious situation, and we need for everyone to hear what we're saying. And that's going to take all of us, and I'm so happy that we're all here to represent NISNA and represent what we actually do every single day. I am a Harlemite. I live in Harlem. I chose to work in Harlem and left private sector to work here because I'm raising my children here, and I want to make sure that our community gets the best care possible, and I knew that I could deliver that. So we are making the choice to live and work in this community. We're making the choice each and every day to come and give the best that we can under circumstances that a lot of our counterparts in the private sector would never ever deal with. And that unfortunately, it actually is displayed in our paychecks. I have a child, well, I have a son who is in college, and I have a little one who has autism. I am constantly looking at how I need to pay my bills and cut and rob Peter to pay Paul to make sure everything is covered at home. At the same time, I've come in here and I do my best at what I do. And all the nurses, I'm pretty sure there are plenty of nurses here who are going through the same situations in various ways. It saddens me that we have to ask for parity. It saddens me because we're giving excellent care. Private sector nurses are giving excellent care. What makes her different from me? What makes him different from me? Money. That's the difference. They're choosing to work in a place where they feel valued. I'm not feeling valued right now. And that's because of the fact that I'm feeling like someone who's doing the exact same thing that I'm doing is getting paid a whole lot more. And it's not fair. So I'm asking that we really focus on safe staffing for our nurses. We focus on parity for our nurses, and we focus on making sure that we keep nurses here. I've been a nurse now for over 20 years. I've been in Harlem now for 16 years. If all of these new nurses are leaving, what are we gonna have left? Because I'm getting ready to leave in a little while, because I'm gonna retire. A lot of these nurses here have been nurses for 20, 30 years. We can't be nurses forever. What are y'all gonna do? And we all have to start thinking about that. So pay us what we're worth. That's what I'm asking for. And thank you very much.
Thank you for your comments. The next speaker is Mary Madden, nurse practitioner, and after that is Mizu King.
Good evening. My name is Mary Catherine Madden. I'm a nurse practitioner at Elmhurst Hospital for the past 24 years. I work for the surgery department specializing in breast cancer care, coordinating all the surgical breast cancer care at Elmhurst Hospital. And I would like to talk to you about administrative time. So administrative time is time that is a crucial tool that is not consistently available to the NPs across the various health and hospital facilities and services. When I became on the negotiating committee, I reached out to NPs at all the other facilities, and everybody has a different experience when it comes to administrative time, and depending on the services that they work for. There are many nurse practitioners across the city who are working 10 patient-forward sessions a week, and then they have really very little time or no time to do their administrative time. NPs are squeezing this important part of our responsibilities, often on their own unpaid personal time, before work, after work, and during lunch. These tasks include med refill requests from patients and pharmacies, addressing abnormal lab and image results, responding to direct messages in Epic. The stress of not having administrative time is a safety and a retention issue. Many NPs have reported to me that administrative time is an important facet of safe staffing for the NPs, and it is a crucial thing that they are reporting to me all over the city. 4 hours of uninterrupted administrative time is needed to tackle the complexity of reaching patients, using interpreters, and documenting the interventions. Thank you.
Thanks for your remarks. The next speaker is Nusu King, RN in the emergency department at Lincoln.
Good evening, everyone. Good evening, panel. Good evening, my fellow courageous nurses. My name is Musu King, and I have worked at Lincoln Hospital for over 7 years. Actually, my anniversary to be 8 years is coming up. I am also the local bargaining vice president at Lincoln Hospital, representing my amazing and courageous nurses. I currently work in the emergency department. With the shortage of staffing and the influx of migrants, a typical day is very hectic. On a good day, we should have 3 nurses in each zone of the ED, but most days we only staff with 2, and some days 1. In the critical zone area, which is our hold for MICU patients or very sick patients, sometimes it's supposed to be 5 nurses, but we usually have 3, and right now, the 3 consist of 1 staff and 2 agency nurses. And on a very good day, we can have 4, which that day is like a mini holiday vacation for us. We get so excited. Usually, we take care of 6 to 7 patients instead of 2 critical A patients. I have worked in the C zone with 3 vented patients by myself. I care for these people. These are people that I see in my community. These are people that I can relate to, as I also have health issues. And I wonder, what will happen if I happen to lay down on that bed? How am I going to be cared for? I know if I go to Lincoln, I will get the best treatment, because you know why? My nurses are going to lift me up. But not everybody have that opportunity, and it shouldn't be like that. Every patient is a VIP. My number 1 concern is safety for patients and even for us. We have been abused by patients constantly, physically, mentally, and verbally. And sometimes we just laugh at it. But doesn't mean we're really laughing? No, we are bleeding inside. But we give the facial expression that we are okay, but we really not. When patients get frustrated, they take the anger on the nurse, not the doctors. Because the doctor go there and said, oh, I order your pain medication, the nurse will come with it right now. Forgetting the fact you only have 2 nurses working in the zone and there's like 30-something patients. So I always say to the resident, do not ever tell my patient I'll be there right now, because it ain't gonna happen. And it's not the truth. When you tell them that, they get frustrated at me for trying to do my job. Nurses do so much that we can. We help each other out. And very recently, we had a very traumatic arrest. Everybody know Lincoln is #1 trauma center for adults. And we see everything. We've been there, done that. So much that you don't feel the pain no more of seeing people dying. We have a very traumatic case. Me with my health concerns and my health issues, I had to put it on the side to take care of these patients. And that same day, I end up being sick myself because of the running and I was doing up and down. And I end up being admitted also. Very close to being intubated because of my asthma exacerbation. But I had to not stay in the hospital, forgo myself because I have to go home and relieve my nanny so that I can care for my daughter who has a disability. I sacrificed myself for my daughter. As I stand here, I have 3 girls. One is about to go to college with a straight 4.0. She wants to go to Columbia. But I'm finding a way to tell her I cannot afford it, which is not fair to her. She worked very hard for it, but I can't afford it. I'm not willing to take another student loan for her when I haven't even finished paying mine. How can I care for her? And how can I tell her, you can't go to an Ivy League school because I can't afford it? It's a shame on me and a slap in my face as a mother. And I'm bleeding. As I stand here also, my daughter is right now very sick at home. But I choose to come here to testify to the work that we do every day. We sacrifice ourselves. We need pay parity. We need safe staffing. I can tell you, everybody in this room, one way or the other, have been assaulted by a patient. Not because the patients want to do it, but because they are frustrated. I have seen very sick patients walk out of the emergency department because of the long wait time. Some days I'm not in critical zone. I'm in a different area working. But because Lincoln, we have so much of these patients, ambulance coming in day and night, every hour, every minute, I have to leave my work area to come and support my critical zone nurses, who some of them are just like fresh off orientation. It's not fair to them. They're very scared because they're scared of losing their license. They're scared of making mad errors. And we saw what happened to the nurse that made a mad error. I don't want to go into the details. I think we can look it up.
Your time is expired. Would
Thank
mind
you so much.
giving your remarks? Thank you. Thanks for your remarks. The next speaker is Shaina Marston from Correctional Health Services, and after that is Bernadette Carter. Shaina Marston? Both of them? Okay, Bernadette Carter also gone, okay. If they come back, let me know. Next speaker, we have 2 speakers left. Priscilla Utabunwa, and I'm sorry if I didn't do that very well.
Good evening, Dr. Cass. Good evening, the board. Good evening, Harlem leaders. Good evening, my fellow nurses. Good evening, everyone present here this evening. It's Priscilla Utabunwa Wachuku. I'm an care manager here at Harlem Hospital. And I came to Harlem Hospital in 2014. I've been here roughly this month, April is my 8th year here. And when I came, I began from at the emergency room. It was a problem with staffing. I remember when I was in the emergency room, I had to take care of 21 patients on a red zone. You know, nurses that work in the emergency room, they know what I'm talking about. 21 patients, all by myself for 12 hours. I've been I was placed as a trauma nurse consecutively for 3 weeks. 1 person trauma nurse. Now I am an accountable care manager since 2019 up to now. Personally, I've been there 7 months now, all by myself, covering the entire med-surg floor here at Harlem. It's rough, it's hard. Last week, I had one of my friends at Bronze Care laugh me to scorn. She wants to transfer to a psych unit. I invited her to come to us. Priscilla, are you crazy? You want me to come? Don't you realize I'm gonna pay my bills? I have my house to pay. I can't come. Are they holding your certificate there? Don't you realize what they have is your photocopies? What are you doing? But you know why I'm here up to today. When I was looking for a 12-hour shift to accommodate my family, it was Harlem Hospital that offered a position for me, so I did not want to disappoint them. I wanted to stay and give it back to them. Even when I came here, I lost 20,000 from what I used to get. But I was like, what is it that nurses here are here for? 20,000 cut from my initial salary. How I got adjusted to it till today, I don't even know. But I'm here today. 3 kids in college, 2 other ones in tuition-paying schools. I have my tuition on my students' loan piled up. I have all of them. Credit card bills are there. My car insurance is going to be due in June. Where is the money? We need quality time for our families. Running around doing 2 jobs, 3 jobs is not fair to us. It's not a fun. We need to reserve those times for our families. We need to get paid like others. They are doing the same thing with us. All of them are doing the same, even we are doing better than them, but they get paid more. I remember when my husband was admitted 2 years ago in Monty. Nurses are fresh looking, nice looking, going robustly. They look at us, they look at our faces. We are all drained. We are all frustrated. But because we chose to be here, we love Harlem. Nobody is tying us here. We have our new nurses coming here, get experience, they leave. It's not supposed to be so. We need to retain them. Anything it takes for you to retain all these old nurses here, we need on deck experienced nurses to be here, to support our nurses, to give them, our patients, give them quality time that they need, and have quality time for our own families. Thank you so much.
Next speaker and the last speaker is Jones. That's true, then you were the last speaker for your remarks. And I now call this meeting adjourned. Thanks for your participation.